Greetings all. We have all gathered here to conference various concepts and technology. Today, we are going to see, to believe, or to nullify the axioms. Many methods used in clinical dentistry are well established, but they are not often supported by a proper evidence. In the era of evidence-based dentistry, it is appropriate to scrutinize such issues. The aim of our study was to assess the knowledge and attitude about face bone and occlusion in prosthodontics among prosthodontist and general dentists. We must assess the correlation between the knowledge, patient satisfaction, attitude, and the evidence of the same. We did a convenient sampling. We included prosthodontist and general dentist who does general practice. We excluded dentist who does only specialty practice as well as we're not willing to participate, and the incomplete forms were excluded. Each questionnaire was in English, self-administered, was validated, and was sent through web portal. And the responses were collected. Each knowledge-based question, the right answer was given one, wrong answer, we didn't give any score. The patient satisfaction, we had 3 options, and attitude-based questions were yes or no type of questions. These are the questions. We did a chi-square test. Out of 800 forms, 135 forms were excluded because they were incomplete. We got a response rate of 80%. The prosthodontist does more than 15 complete dentists per year, whereas general dentist was 5 to 15. The knowledge was high among both prosthodontist as well as general dentist, whereas the chewing ability and the aesthetic appearance, patient satisfaction, it was more between both bilateral as well as current guided. Pertaining to face bow, the knowledge was high among prosthodontists, was moderate among general dentists. In spite of high and moderate knowledge, it is being very less used in clinical practice. In spite of very less used in clinical practice, they had a higher patient satisfaction. The concept of balanced articulation was given by Bono in the year 1817. He stated that bringing a larger amount of grinding surface into contact will equalizes the muscle actions, equalize the pressure, equalizes the forces. But according to Shepard in the year 1968, he stated that whenever the bolus is in, the balance goes out, not ever during mastication, but also during drinking or while speaking or singing. So this can be pictorially represented by when the bolus is in, the balance goes out. In our study, the knowledge was good. In spite of knowledge, it is very less used. That is, bilateral balanced occlusion is less used because of maybe the adherence to academic clinical procedures in colleges. Only those prosthodontists were practicing bilateral balanced occlusion, whereas the remaining prosthodontist and general dentist, they follow a canine guided occlusion. This may be because the dental labs which we are giving, they don't have adequate training, or they are trained only for a canine guided occlusion. The patient satisfaction, chewing ability as well as the chewing ability as well as the aesthetic appearance was good, which is similar to both Shirani and Nidhi Dudal. This is because we use an acrylic teeth for an artificial complete denture. Those complete dentures on frequent uses, that is on 3 months, the teeth get accreted and finally it will goes to a bilateral balanced occlusion. Coming to the evidence, various systematic reviews, randomized clinical trials, they have compared the complete bilateral balanced occlusion as well as the canine guided occlusion, and they concluded that there is no evidence to support the balanced occlusion promotes better masticatory efficiency or chewing experience or the patient satisfaction. But why still we advocate the bilateral balanced occlusion? It protects the bone resorption by equal distribution of stresses on the alveolar ridges. According to Brewer, the mastication is only taking place for 10 minutes in a day. But whereas other parafunctional activities like settling effect or while swallowing or while bruxism, it comes for 4 hours of contact. So it is not alone only for 10 minutes, but also 4 hours. So stability of a denture is very important and it is critical. Further clinical studies are necessary for a stronger evidence. This is paving way for further research whether a canine guided occlusion is a perfect alternative for a complete denture. Similarly, for a face bow, for using the face bow or without using the face bow. Previously, authors stated that if you don't locate a perfect inch axis or if you don't use a face bow, it results in occlusal errors in our indirect restorations. But various clinical studies, they showed that there is no significant difference even with use or without the use of face bow. In our study, both had adequate knowledge, but in spite of knowledge, they had not been practiced. In spite of not using it, the patient satisfaction was good. So coming to the evidence, various randomized clinical trials were conducted. They compared with the Facebook, without Facebook, all stated that there was no significant difference. This is why it is happening. This is because of continuous research. The concepts that are believed and used previously are being nullified and started believing the evidence. Even the Boucher, who previously advocated the use of Facebook in his previous editions, has changed his own thoughts, like it is not necessary to use the Facebook in all the cases. This is own quotation from its book that the theoretical advantage of using a Facebook to mount a maxillary cast and articulator are obvious. But there is evidence that the need for a Facebook record is not supported clinically. So I conclude by saying that in our study, as well as current scientific evidence shows, the treatment outcome is similar for both occlusal concepts, that is bilateral balanced as well as cone guided, with or without the use of Facebook transfer. So whenever it is possible, go for the simplified technique. Why? It is easier to master and it is cost effective also, and it is very easier for the patient to accommodate. The educator should consider these findings when designing the curricula for the prosthodontic training. But it is not incorrect to construct a denture with balanced occlusion. It seems the need and attitudes of the individual patient may have been overestimated. Whenever possible, the Ken and Garrett dentures can be constructed with an acceptable clinical result in a minimum amount of time. We should not forget that we have an adequate evidence that the decision is best suited for the patients. So now it's in your wisdom to believe or to nullify the axioms. I conclude by saying that simplicity is the ultimate sophistication, as said by Leonardo da Vinci. Thank you.